Is the medical community failing women who suffer from endometriosis, a chronic condition that affects more than 10% of all women in the United States? That's a question Cape Cod local Jamie Carter is now asking after spending nearly 3 decades living with untreated and misdiagnosed endometriosis.
I didn't get my diagnosis until I was in my 40s. And my symptoms started when I was 14, when I got my period. Horrible cramps, back pain, on the floor, in the bathroom, in the fetal position. Missing a day of school every month is how I started my teenage years. And nobody seemed to think that that was abnormal.
According to the American College of Obstetricians and Gynecologists, endometriosis is a condition in which the type of tissue that lines the uterus is found outside the uterus.
When you have endometriosis, they're very similar cells, but they could be anywhere in your pelvic cavity, your thoracic cavity, on your lungs, on your diaphragm, on your liver, on your bowel, on your bladder, on your ureters, on your fallopian tubes, on your ovaries. So when your hormones signal it's time for you to have a period, those cells listen and they have it, except it's inside your body and there's no place for it to go.
Since the 1920s, doctors have believed the way to cure endometriosis was through hormone treatments, ablation, or entire removal of the uterus. But Dr. Mackenzie at Mount Auburn Hospital in Cambridge says these treatments don't work.
When you understand endometriosis in one way, by which it's been understood since 1927, and it is wrong, then you're going to have no ability to sort of say other than, I'm sorry, we can treat your symptoms maybe. Let's treat your symptoms. Can't treat the disease. Let's treat your symptoms.
After trying all of the standard forms of treatment, Jamie underwent radical wide-field excision surgery with Dr. Mackenzie, who successfully removed the endometriosis from her body.
The treatment that I used to use, which I'd been taught in medical school, wasn't working. It didn't work, and there's something desperately wrong with it. And so I said, why am I going to continue doing something that isn't working? Started paying attention to what other people were doing throughout the country, and a few handful of people doing this procedure, and paid attention to what they were writing and doing, and then started moving to that, slowly doing more excision. And really for the last 15 years been doing excision. This has been the most satisfying work I've done to create significant transformation in people's lives.
Outdated science, lack of funding and research are just some of the reasons Dr. Mackenzie says more progress hasn't been made to provide a better standard of care.
Minimal research being devoted to endometriosis, almost none. This endometriosis ain't your mother's endometriosis. It's totally changed in terms of how we understand endometriosis. It's sort of the front end, small number of folks who are saying, wait a minute, we've got this disease totally wrong.
Thanks to Dr. Mackenzie, Jamie Carter is now on the path to recovery, but she wishes it wouldn't have taken so long.
I've met so many friends on this journey, and one of them, Rachel, wrote so painstakingly, powerfully the other day that she always dreamed of being a mother, and now she has to learn how to mother herself because her first surgery, first of maybe 4 or 5 that she's had for this, they took out her uterus and her ovaries and her fallopian tubes, basically female castration, and then noted that they saw endometriosis in there and they were leaving it inside her body. So now she can't have any children and she still has endometriosis. It just doesn't make sense.
In Cambridge, Massachusetts, for Cape Media News, I'm Gabrielle Rosson.